48 News at 10 with Kim Essex.
Only tonight on 48, we have shocking allegations about veterans' mistreatment here in Huntsville. Two former employees reached out to us independently about how they say the Floyd E. Tutfan home is failing to provide basic care for veterans staying there. We found records that support some of their claims, and tonight Alabama's VA commissioner is vowing to investigate. WFF 48's Chris Joseph has been researching this story for months now. Chris, what are those employees telling you?
Kim, they claim veterans are being neglected, fed the wrong diets, and bed bugs are being left untreated throughout the facility. Both employees left Tutfan in the last 3 months, one saying she was fired and the other saying she left because the treatment of the veterans was unconscionable. They requested to remain anonymous over concerns of future employment. So with that in mind, I did some digging to see whether there was any validity to what they were claiming. State and federal inspections paint a very mixed picture about the level of care veterans are receiving at this home. The Floyd E. Tutfan Veterans Home helps some of America's best as their health declines. Those veterans, some who are unable to speak for themselves, are reliant on Tutfan's caregivers for comfort and safety. Two former workers reached out to WAFF, claiming the home is falling short. The first, a former housekeeper, alleges the following: bed bugs in multiple wings, infecting one of her coworkers. She also claims a patient with skin mites was not receiving any treatment. The former employee says she reported both to the administration, but no action was taken. She also says she saw a patient develop bed sores because of staff negligence. The second, a former dietary cook, also brought up the skin mites patient without being asked. She says the patient roams the home unrestricted. The former cook also alleges veterans are being fed diets that are against doctor's orders. When she brought up those concerns with a manager, the former cook says she was told, "I don't care." I reached out to HMR Veterans Services, who is contracted by the VA and oversees the day-to-day operations of the facility. HMR's Vice President Scott Hurst declined our repeated requests for an interview, but just today he sent WAFF this statement, which reads in part, "Nothing is more important to us than providing the highest quality of care possible to our veterans. We work closely with state and federal agencies and follow important guidelines and procedures in providing care. For example, a recent independent survey named Tutfan in the top 15% in the country, which included nursing service, dining service, food quality, communication, cleanliness, activities, and dignity and respect for veterans. The most recent federal compliance survey from the Veterans Administration found the facility to be in compliance with all requirements. Saying he was barred by state and federal law from discussing any individual patient's care, Hurst would neither confirm nor deny any claims made by the former employees. So I did some digging. The Alabama Department of Public Health publishes these surveys about nursing homes roughly once a year, and upon getting a complaint, the findings were mixed and troubling. The Alabama Department of Public Health's most recent survey in January only found Tutfan in violation of some sprinkler procedures and disorganized kitchen appliances. A July 2018 federal VA inspection also came back spotless, and in 2016, Tutfan won an award for its care plan. But state surveys from the prior 6 years paint a much different picture. They cite nurses failing to give a veteran a doctor-mandated diet, a veteran receiving undocumented and unregulated tube feeding, a veteran not receiving incontinence care in the necessary time frame, a patient's documentation saying, "Do not resuscitate in the event of no pulse," when it should have read, "full code" or "resuscitation requested." And in one case, according to the survey, a nurse failed to perform CPR when a patient was without a pulse. I reached out to the Department of Public Health, who said this: "Deficient practices are fairly common. Our surveyors are focused on finding out whether or not facilities are in compliance with state and federal regulations. Unless the deficient practices are totally egregious, they would not stand out to the department." But some of the facility's alleged practices did stand out to one local attorney and prompted him to file a lawsuit. In 2007, Huntsville lawyer Tommy Sinyard sued Tutfan, alleging veterans' mistreatment. He represented a father-son duo where secret video recordings allegedly showed the father being abandoned for 12 hours at a time and being struck by employees. The case was settled confidentially. Sinyard couldn't talk about Tutfan, but says this about nursing homes in general.
What we see is, sadly, is not huge, complicated medical mistakes. It's people that fail to get properly watered, have water, fed, turned in their bed so they don't get pressure sores or bed sores, falls where they're inappropriately assisted to the restroom or to their wheelchair.
Treatment. That's right. I met with Alabama VA Commissioner Kent Davis in Montgomery about the employees' allegations and to talk the home's history. He vowed to visit Tutfan in March to investigate.
Our utmost concern is care of veterans. That's why we exist as a department. That's what we're about here. We take very seriously any allegation of neglect or mistreatment. I can tell you this. I did not know the specific allegations until you showed up today.
So tonight, the level of care the veterans are receiving at the facility really depends on who you ask. You can find more information about those past violations at the Tutfan home and how they were addressed on WAFF.com. On your screen now is the hotline for the Alabama Department of Public Health. That's who you should contact if you're concerned about a veteran being mistreated. Kim?
All right, thank you, Chris.